Hi, I'm Dr. Amna Husain, board-certified pediatrician, board-certified lactation consultant, and mom. Today we're going to talk about the 3 things your pediatrician wants to tell you about your child's cold. Alright guys, it's cough and cold season, and we probably sound like a broken record when oftentimes you bring your child in and we're like, it's a cold. We unfortunately have to wait for it to get better, but you really want to be able to do something as a parent. So these are the top 3 things I often find myself reviewing with parents. Now in this video, we're not going to be talking about really important topics like fever and hydration. Those are really important topics when it comes to taking care of a sick child. This video does not substitute personal medical advice. This video is going to go over from a tutorial standpoint some of the things that I'd like you to know when it comes to caring for a child for a cold. First off, suctioning. Suctioning really takes care of a lot of the nasal mucus that builds up. The runny nose, the congested nose, when you lay back, the postnasal drip that causes a cough. Honestly, it's one of the worst symptoms. And as an adult, you're probably able to blow your nose. But as a child, we're not able to do that as much. And it's very tough to teach your child to do so. So I'm going to share some video footage here where you can actually see how I assemble something like a nose Frida device and then use saline to help clear nasal secretions in a young child. So this is my daughter. We're using saline here. We're able to put a few drops in the nose, and thereafter I chase it with a nose Frida to be able to clear that congestion now. Now, I typically recommend doing this when it's the most effective. So maybe first thing in the morning before they're able to nurse or drink, so that you're able to clear some of that congestion that's built up overnight. Maybe right before their naps, so that again they're going to feel comfortable before they go down to sleep. Maybe again before they go down to sleep at night as well would be helpful. Now usually if they're going to take a bath, sometimes I skip the saline because the warm water will also have helped to soften those boogers up. Now you could also do this with a bulb syringe. Personally, I'm not as big of a fan of a bulb syringe because sometimes when they're bluntly stuck upward, they can cause some very minor damage or trauma to those delicate nasal airways and passages. Also, sometimes parents may not be completely comfortable using it, so it works by essentially creating a vacuum and then releasing your thumb so that it sucks all those boogers out. I often feel like I'm chasing boogers a lot, even though I know how to use it pretty well, so I'm just not as big of a fan. I'm pretty fond of nose Fridas though. You can also use something very popular about saline lavage. I've done quite a few videos on those on my TikTok, but also on my Instagram, so I'm going to highly recommend that you check those videos out because that can be kind of intimidating for a lot of parents who haven't done it before. I've done it a few times because my child has allergies, and so our allergist recommends it to clear some of those allergens during her troublesome seasons like the spring. But if you're not really comfortable, there are important things you need to know, like using distilled water, having your child lean forward, things to look out for if your child's uncomfortable, like they're feeling ear fullness. So I highly recommend you check those videos out on my other platforms. All right, the second thing that your pediatrician wants you to know is to watch out for something that we call retractions, which is a sign that your child may be working very hard to breathe. So as a pediatrician, when a child comes in, I often start counting their respiratory rate while I'm in the room before I even touch them, because oftentimes if they're around me and they're not feeling well, they all of a sudden get agitated and their respiratory rate goes up. So I want to see them when they're kind of relaxed. I look at a lot of things. First off, I look at their belly. Is their belly moving in and out? And I kind of demonstrate with families what that looks like. You're also going to want to look at their rib cage right here. So if it's kind of tucking and sucking in under, or you're seeing the lines of their ribs, those are also retractions. We're going to want to see if that's actually present because that shows your child's working quite hard to breathe. Another place in the body where your child may have retractions is right near the clavicles. So that's going to be another place that I often demonstrate to parents what it's going to kind of look like. You can sometimes see the trachea as well. So this outline where they're really tugging inward, and so those are all things that actually you can see very distinctly if you know what to look for. And so your clinician, your pediatrician wants you to know that you're going to keep an eye out for those. Sometimes those can be present and the oxygen levels might be normal, and sometimes those can be present and the oxygen levels are not going in the right direction. So you're going to want to alert your pediatrician if you see any of those signs, even subtle ones like the nostrils flaring. We call that nasal flaring. You're going to want to keep an eye on that. Last thing I want parents to know. we can't really recommend cough medicine because we don't think it's that helpful for children. I know that a lot of adults use cough medicine. I know that if you go see your doctor, you might get something like steroids or an antibiotic like a Z-Pak. Your doctor might even give you something like Tessalon pearls to help suppress the cough, to help you get some of that mucus out. We unfortunately cannot recommend those things in pediatrics. They're not studied, they're not safe. They can sometimes also have other medications involved with them as well, like Tylenol. And so if you give that plus something like Tylenol to decrease your child's fever, you might be overdosing them. If you have more questions on medicines and the safety of these cough medicines with children, I highly recommend you look at my other video on cough and cold questions that I've answered. We discussed this topic in depth. All right, guys, I hope that was helpful. If it was, give it a thumbs up. I hope to see you next week and try to stay healthy out there. Bye.